Tech giants around the world have started to develop COVID-19 screening tools, but as I scroll through these questions, there are two that I can't confidently answer. Where did I go and who did I contact? In lieu of these answers, we've all changed our behaviors. One striking change is that governments have ordered everyone to stay at home and non-essential businesses to close. But how can we still thrive? To address these challenges, we introduced CommonThread, a local knowledge repository that connects individuals, service providers, and health departments. Our goal is to increase individual awareness, agency, and community around COVID-19. Upon downloading the app, individuals complete a screening tool to assess their initial risk, and then the location data updates the risk in real time based on where they go and who they are in contact with. These updates are based on dynamic evidence of social distancing. As a precaution, new users are categorized as medium risk for the first 14 days. Following this period, a user may obtain a low-risk green score if they remain without symptoms and do not come into contact with a COVID-19 positive response. If this does happen, their risk level increases to yellow. The best part, businesses have their own side of the app, and if they want to, they can use this tool to screen entering patrons, giving them more agency to control risk of transmission. This means local governments can soften policy decisions and balance trade-offs between the public's transmission risk and quality of life. Health department staff can use this real-time data to assess individual and community risk. In the short term, this can help under-resourced health departments triage tests, and in the long run, this can increase prevention, adaptation, and resiliency to global health outbreaks. We deployed a market research survey and found from over 250 responses, individuals do want to know their own risk of contracting and transmitting COVID-19, and business owners do want to reopen their businesses if there was a way to determine risk status of their patrons. To add immediate value, we propose adding at a minimum new questions to current screening tools. Next, we will identify an interested city to pilot a minimal viable product version of CommonThread. We also look forward to the inevitable. Our long-term vision is a high-reliability approach that looks at a crisis like this as a process, not a singular event. If a new, natural, highly infectious disease emerges, location-based contact tracing will once again be critical. To move this forward, we are looking for these listed partners to help develop the CommonThread.